So we did that traction for 2 minutes. And I'm retesting now. So I'm taking up the slack, and now I'm springing and I see movement through your toes. And now I have you in extension. And now I can traction you. Now I can take up the slack, and when I spring you, I see your feet move up and down slightly. So we gained some motion, but I'm curious to know how you feel. So let's have you stand up.
Okay.
Go ahead and walk down the hall and back once.
Cool. It does feel nice. I'm more naturally putting weight through my heels rather than on the balls of my feet.
Interesting. Interesting.
Yeah.
And how does your head and neck feel?
Feel more natural. Good. I do feel like it's more upright.
Okay, okay. Nice. Good. So I'm going to refer you to another video that I have up. And I'll give you that link. I'll send it to you in an email. And it's called Upper Cervical Exercises. And just type in my last name, which is Hesch, H-E-S like Sam, C-H, Upper Cervical Exercises on YouTube. And that will show you ways to keep it.
Okay.
Okay? And then tomorrow I'll go ahead and show you those exercises. And I'll have you lay in a neck cradle to do those exercises. And that neck cradle is about $30 on Amazon. It's called Dr. Reiter's Real Ease. And you'll see it in the video, and I'll show you that tomorrow.
Okay.
So yeah, I think there's multiple causes of someone having a somewhat forward head, and certainly it affects the upper joints of the neck as much as it does the middle or lower joints. And I think there's different causes, and I've had people with present similar to you, but they had a lack of ankle motion. And in restoring the ankle motion, then the neck mobility, upper cervical restored. I've had people who had no hip rotation, internal rotation. I had one dramatic case, and he had 0 internal rotation, and we've restored that motion. Again, you can search my last name and internal rotation of the hip, and you'll find other videos on that. But we gained more than 45 degrees of internal rotation of his hip, and his upper neck just melted. And his upper neck rotation increased, and his traction in the upper neck released without me touching his neck. So this is based on a whole body philosophy and finding the area in the body that has a distinct restriction. Okay? And some people can improve their posture consciously. I don't believe you're one of those. I believe that extension tone in the upper neck was maintained by your nervous system, and it just needed to be reset. And we could talk about biomechanics of the first and second joint of the neck, and talk about the upward and downward motion of that ring, that donut, that sits on a peg called a dens. But we don't have any way to image that in the clinic, so it is a theoretical construct. So I'm not gonna pontificate on that. I have a book chapter coming out this month on the upper cervical spine. It's in a book called Movement Integration. And this is a nice example, a nice case. Thanks for letting us film it.
Yes, sir.